Alrighty. Welcome to the Gorgeous Glow Skin Show. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the GRxSystem. I help women who want to have even and clear skin tone with increased confidence. If that's you, you're at the right place. So the question today is what to do if you have a chemical burn from having your chemical peels. So what we recommend, first of all, you experience a burning sensation. And even though your operator had rinsed the area off or neutralized it with whatever the suggestion is to use, later on you may notice some burning sensation, let's say after you get home, or a tingling, and then you notice the area is red, hot, burning, and that persists. So once you have a chemical peel, by right, once your operator is finished neutralizing the area, you shouldn't feel anything. And a lot of times if the neutralizing product is water and it's cold water, you sort of get numb from the coldness, and later on you don't notice anything, or you may notice a little tingling, but it's when you get home that you start still feeling that sensation, or the sensation gets worse. So if that happens, that means that you still have an active product on your skin and you need to neutralize it. So if it is water, of course, get more water and keep rinsing until you don't feel it any longer. So you don't feel that burning sensation or prickly feeling. And after you pat it dry, wait a couple minutes and see, is that enough? And if that's not enough, keep rinsing until that sensation has resolved. But let's say you notice that, the sensation resolves, but then your skin is peeling, and to the point that you think normal skin is coming off at this point. It's really red, irritated, very sensitive, and those are the symptoms that you would feel after the chemical peel has been neutralized, and a couple minutes or a couple hours later, you still having this pain, but it's not burning. It's just a very significant discomfort. Well, again, if that happens, you're looking at bad side effect from the product staying on your skin too long, and we call it a chemical burn. But how bad is it? It just depends. But we still treat it the same way initially. So usually the sensations, like I said, the significant discomfort you're feeling, the skin even sloughing off sometimes, or significant more peeling that you're experiencing. If that does happen, then like I said, I like having a gallon of water, and you put a capful of apple cider vinegar in the water, and you put that in the refrigerator, keeping it cool, and then you rinse with that. And I like that because number one, it keeps you cool, but number two, the apple cider vinegar has antibacterial properties. So by rinsing with a gallon of water that contains apple cider vinegar, you're actually decreasing the chances of you getting a secondary infection. But like I said, it's a really nice sensation because the apple cider vinegar also help heal the area, and it just makes it feel much better. So once you do that, you can do that several times a day. There's no limit to how often you need to do that, whatever it takes to make you feel better. That's number one. Number two, you want to use some type of ointment. I like something very simple. Vaseline works well. If you can get your hands on some Cordaid or hydrocortisone 1% over the counter, that works well too. But I like a lot of Vaseline and keeping the skin covered with that. And when the scabs start to form, do not take it off with your hands. Let it come off with rinsing with apple cider vinegar, water with apple cider vinegar, and keeping a lot of ointment on. And the scab will come off on its own. If you pick the scab off, that increases your chance of getting an area with scarring significantly. So again, do not take off any skin that's peeling off. Let it come off on its own when it's ready to. Your job is to keep it clean, pat it dry, and keep ointment on it. The ointment not only will help soothe the area, but it will also allow the skin to heal faster, because it's allowing a matrix there that the skin can cells can float over to help heal the area. If you let it dry out, You know, a lot of people think scabs are better. Not in this case. You do not want a scab to form. When it does, again, soak it off and put the ointment on and let it come off on its own. But you want it to heal without a scab so it won't cause a distortion of the skin when it does heal. A pulling sensation, that you can see when you do have a bad outcome with any kind of chemical burn. Now, over time, as you keep doing that, you'll notice that you don't need to rinse it that often. The discomfort subsides. And if it doesn't, again, I like Tylenol. Tylenol works well for this. But you keep doing that process and give it time. You know, our bodies are amazing. It does a wonderful job of healing itself if it's allowed to do so without much tampering. So a lot of times your body does not need our help to heal. It does a really good job of it on its own. It just needs time to do so. But keep it very simple. Some people like the other products that are ointment based. I keep it very simple. Like I said, I just like Vaseline, as well as you can use hydrocortisone over-the-counter ointment and mix it into Vaseline. But that's basically it. Now, if you go to the doctor and get a prescription, they will give you what they like. I like mid-strength steroid ointments. Again, the key is the ointment base. When you're looking at creams and lotions and gels tend to have alcohol. Well, all creams and lotions and gels will have alcohol in it. Some lotions may have water. However, they tend to have a preservative, which is usually alcohol-based, to allow it to stay on the shelf a long time. So therefore, I don't recommend creams, lotions, or gel-based products. I only recommend ointments because it does not need a preservative in it. And so therefore is, in a sense, the purest form of a product. So after a period of time, usually a week, you would notice that the skin is healed well, and you may have some redness there, and that will fade out over time. You know, at that moment, if you do not have any sensitivity, if you do not have any areas that still need to heal, then you can stop using the ointments, and you can definitely stop using the water that has the apple cider vinegar to rinse. And the redness will fade out over time. Or another good product is Mederma over the counter that does a really good job of getting the redness out. But again, the best thing is to keep it simple. When you do have a process of a burn from a chemical peel, you want to make sure the operator knows immediately what has happened. And a lot of times they will have you back into in the facility so they can treat the area or make suggestions. But you want to let them know immediately so they can help you in the process. And they may have you to come back periodically to make sure you're healing and going in the right direction. And then after the healing has subsided, after you've healed and there is no other concerns, no sensitivity, the redness is gone, you know, to go back to a chemical peel, you can. Usually you do very well, but that's definitely a personal decision. And definitely you need to get down to the reason of why did you have this burn. Was it that the chemical peel was too strong? Was it left on too long? Or were you using the product prior to the chemical peel, another type of an exfoliator or a toner that sort of dehydrated the skin and that led you to having this problem with the chemical peel? So you definitely want to get to the bottom of, again, why it happened so you can rectify that and make sure it doesn't happen again. Any questions? Well, great. Again, another thing, wear your sunscreen. So if you go out, wear sunscreen once you're healed. But regardless, thank you again for joining me. I'm your host, Dr. Sonia Johnson. I'm a board-certified dermatologist and creator of the GRxSystem. I have women who want to have even and clear skin tone with increased confidence. If that's you, thank you for joining me tonight. And join our Facebook community, Gorgeous Gal Crew. Take care. GorgeousGalCrew.com. Take care. Bye-bye.